Okay, I'm going to go ahead and jump in. I know we might have a few more people joining us, but thank you all for joining. I'm so excited to have Dr. Gregory Buford as our host tonight for our webinar on EON. A Denver, Colorado board certified plastic surgeon, Dr. Gregory Buford specializes in non-invasive and cosmetic plastic surgery procedures that empower you to look and feel your best. A nationally recognized expert and trainer in the safe and effective use of injectables, Dr. Buford is renowned for his expertise in breast enhancements, including Denver breast augmentation and breast lift, abdominoplasty, liposuctions, and facials, along with his revolutionary Before Baby Body program for moms looking to regain their pre-pregnancy bodies and confidence. Dr. Buford has a proven reputation and the quality or qualifications to match, and we are so excited to have him today. I will turn it over to Dr. Buford. Before I do, if you guys do have any questions, please go ahead and put them in the question and answer box, and we will answer those right at the end of the presentation. So, Dr. Buford, the floor is yours.
Wow. So thanks for tuning in tonight. I know everyone has a very busy schedule. I was in the OR all day long. So if I look a little tired, I am, but I get excited about this kind of stuff. Why am I on a webinar talking about EON? Because it's a device that really, really works. I've had this for a couple of years in my office. I'll talk in a couple of minutes about how I got actually introduced to Dominion, but I've been with the company, been with it as a consultant and as a user of the device for several years, because bottom line is it works. It's been a great adjunct to my surgical and non-surgical practice, and I'll talk a little bit about that. So without further ado, I'm going to get into a little bit about who I am. As mentioned, and thank you for the very humbling introduction. I am a board certified plastic surgeon here practicing in Denver, Colorado. I have been doing this for about 21 years. I have both a surgical as well as a non-surgical side of my practice, which I think a lot of plastic surgery practices, now have. Now, I don't know how many of you guys are plastic surgeons on the call, or dermatologists, or any other specialty, or med spa, what have you. But this is a great fit for a number of different practices. Even if you don't have the body contouring element in your practice, it's actually a great thing to add on to enter that foray, so to speak. So a little bit of my background, my conflict disclosure. Obviously, I've been a consultant with Dominion for a few years, and I was actually proudly, during COVID, when we were all thinking the sky was falling, that I was actually the chair of the commercial launch advisory board. So, like I said, been with them for a couple of years. I've got to know the machine, very, very well, and have used it on a good number of patients with great outcomes. So let's talk a little bit about what we're talking about tonight. So I'm going to roll this video. Let's see if I can actually get this started here. Couple things here. So this is a device, EON Smarter Body Contouring. Couple things. It's more effective, more efficient, and more comfortable. If you think about it, what are the things that you are looking at? Again, if someone comes to me and says, I'm looking at buying a device, the questions they're going to ask are, one, is a device, is it affordable? Is it skyrocketingly high? Very, very affordable price point for this. I think it's actually positioned very well. Two, most importantly, does it actually work? Okay. Does it actually work for our clients? Because efficacy is one of the most important things. Second, safety. Is it safe? Have you seen a lot of adverse events? I'll go into that a little bit later, but the answer is no. We have not seen any adverse events. We've had a total of 0 burns. We've had a total 0 issues with what is called PAH, paradoxical adipose hyperplasia. That's regrowth or hyperplasia of fat after treatment with similar body contouring devices. I have not seen that. And it's also as well too, and this is super, super important, it's also comfortable. So if your patient's jumping off the table and you're telling them that they're going to need a few treatments, they're not coming back. So again, it's effective, it's efficient, and it's comfortable. It works, it's safe, and your patients can tolerate it. How do I know that? Because I actually have had a couple treatments myself. So we'll talk about a couple things here. So EON, it's been around for several years. It's backed by years of research by industry-leading scientists and doctors, and it leverages innovative touchless technology to advance the laser aesthetic industry. And I really like this because, this was actually launched, right around the time of COVID, or I actually should say post-COVID, when we didn't really want to touch anything. And now the patients, we're out of COVID, supposedly, but patients like the fact that they don't have applicators. There's nothing to put on. Our technicians, our assistants, our extenders, whatever you want to call them, anybody that's applying this doesn't have to use applicators, and it makes it so much easier to use. So we'll talk a little bit about this, but state-of-the-art robotic precision delivers laser energy and cooling simultaneously. Okay. So the laser, this is a diode laser that's delivering the energy. So there's heat energy that, that's obviously going beneath the skin, below the dermis into the subcutaneous space. It's heating up the fat to a certain degree, but it's also using concurrent or concomitant jet cooling fans, I should say, for lack of a better term, to actually cool the space as well too. So during that time, even though the heat energy is being delivered, it's not burning your skin. Like I said, we've had a total of 0 burns so far. So at this point right now, I got on when it was only FDA cleared for the abdomen. Currently, it's cleared for treatment of the thighs, flanks, full abdomen, and back, which really gives you a lot of very unique treatment areas. And most importantly, these are the areas that your patients are asking for. So there's a number of smart sensor on technology actually on this device. So it looks at proximity, it looks at topography and distance. So it maps out the topography of your patient's treatment site. So say it's on the abdomen or the flanks, or what have you. It's mapping out the rounded curves. It's identifying the distance of treatment. So it's making sure that it's not too close, not too far, so that you're getting that even melting, but you're also getting the jet cooling. So your patient is very, very comfortable. It also identifies temperature as well too. Temperature of the patient, temperature of the laser, and temperature of the cooling. All of these are done simultaneously. So your patient has a good experience, but the laser is also able to do, or I should say the device is able to do what it needs to do to achieve maximum efficiency and efficacy. A gyro. Okay, so that determines the movement, the force, and the position. And this actually will move itself. And I really apologize for not showing that video. I'm hoping some of our other videos work on this, because it's a really cool thing. You'll see actually how the handpiece is actually self-functioning. So your technician, whoever's running this, is not really doing much of anything other than making sure the patient's staying still, there's the device is not faulting, and that it's operating efficiently. And then also too, there's sensors monitoring airflow, making sure that the impingement cooling is effective. So it's robotic. As you can see here, it's nice that, it controls everything. So it knows exactly how much time it needs over each area. It's touchless, so there's no required gels or applicators. There's no cleanup. There's no post-treatment care. You don't have to numb for this. Your patients literally come in, lie down, get comfortable, and stay still. And that is it. It is probably, jokingly, one of the most boring treatments. The first two treatments that I had, I literally fell asleep. How many treatments do you have, or how many treatment devices do you have in your office where patients are like, that was super boring. I mean, that was super cool. Oh, look, it actually worked. I came in, I had no pain, I have no downtime, didn't have to get numb. The nice thing about the numbing as well, too, is again, there's no cleanup, but also, too, you don't have to tie up a room numbing the patient or treating him beforehand. And again, in terms of any applicators or anything like that, you don't have to worry about it. It's also intuitive as well, too. So the smart sensor technology maps your patient's topography. So you're getting a personalized treatment. This is not one size fits all, because all tummies are not one size fits all. There's a real-time monitoring of skin proximity and temperature, making sure that the most efficacious distance is sustained, and dynamic power adjustments allow for more effective treatments and patient comfort. I mean, again, it's a really boring treatment for your patient, but that's cool, because guess what? It not only works, but your patients come back and they actually get more treatments. And that's a huge, huge, huge plus for the device. So it's FDA cleared for the abdomen. This is a study by Dr. Thomas Fiala. He looked at obviously a 1064 nanometer. It's a diode laser to non-invasively induce apoptosis for lipolysis of subcutaneous abdominal fat. So initially, this was a first treatment. There was an N of 26, so a small study group. But what they noticed, though, is at week 12, and this was without any changes in diet, there was no diuretics used or anything like that, there was a 21.6 or a 6.3 millimeter mean reduction, in abdominal subcutaneous fat thickness, and a 4.1 centimeter mean reduction in abdominal girth or circumference. Most people would say that's total nonsense. You're not going to see that. Well, the funny thing is, the first patient that we actually treated with EON in our office had a 4 centimeter reduction. And we did not tell this patient, to change their diet. Obviously, we're not going to tell them to go out and eat McDonald's and, do something stupid after it. But we did not put them on a diet. We didn't fudge any of this information. And I was actually pleasantly surprised, because I didn't know what to expect. But 4 centimeters, that's what we saw with our first patients. 2 adverse events. So it's always important to talk about adverse events. These were mild transient erythema and localized subcutaneous firmness. Now, we have seen a handful of patients where they've had a little bit of firmness. We've treated these patients essentially with a few days of Advil, okay, or any non-steroidal anti-inflammatory. A couple days of that local massage. Every single one of them has gone away. We have not had any issues with pH. We've not had any issues with permanent issue. And you can see in this study, these all resolve with intervention within 12 weeks. So this is key. You can tell your patients it not only works, but the side effect profile is very low. So the conclusion, the contract-free device was safe and effective for reducing subcutaneous abdominal fat and represented an improvement on the prior treatment protocol. And you can see here, in terms of the clinical results, there was an average upper abdominal fat reduction in 21.6 patients as measured by ultrasound. The average lower abdominal fat was 25.3 measured by ultrasound. The mean reduction in abdominal subcutaneous fat thickness was 6.3, with a circumferential reduction of 4.1 centimeters, and over 73% of patients showed a greater than 20% fat reduction as measured by ultrasound. On the right, you can see the details of the study. It was a wide range of patients, mostly female, but that's actually what we're seeing mostly in our patient population as well. Age 21 to 61, all Fitzpatrick scale skin types, BMIs really range. You have 17.8 to 32.2. Most of the patients that we're seeing in our practice, probably it's Denver, Colorado. So a lot of these patients, they tend to be in fairly good shape. So a lot of them are around probably high teens, maybe some lower teens for touch-up areas, but high teens, maybe in the low 20s, probably not in the 30s. And the mean treatment area was the full abdominal wall. So FDA cleared for abdomen. You can see these treatment photos here. This is the head that's essentially going over the treatment site. It lights up. It's hanging out probably maybe about a centimeter, 2 centimeters above the patient. So it's never really making contact. And then it's moving. You can see the robotic arm. It actually moves to adjust the treatment area. Really, the discomfort is minimal at most, maybe 1.5 out of 10. So super, super easy. We usually recommend about 3 or 4 treatments, each about 6 weeks apart, to the areas of question. Okay, so some of these I'm going to have to tell you what these are. Apparently, one of that last one was actually me getting treated. It was showing essentially that I wasn't moving. There was no pain. This is the money shot right here. So you can see the before, you can see 12 weeks after 3 segments. Okay. The shadow, you see a nice difference in the abdominal wall thickness. You can see another one before on the top, probably a male, obviously 12 weeks after 4 segments, and so on and so forth. So these are really nice results. Now, is it going to compare to liposuction? No, probably is not. But not all of your patients are interested in liposuction. I spent the day today, actually, that's pretty much what I was doing is liposuction. But as much as liposuction is great, you have a lot of patients that are saying, you know what, I want to get toned up before I go on this vacation. I really don't have the downtime. I really don't, I'm a little bit nervous about going in the OR. It's a great introduction. So those of you who have surgical practices, it's not a bad way of getting them introduced to it, and some of the patients will say, well, there's some treatment areas that I can't do with EON. So, I'll go in and do the EON treatments, and then I'll get these other areas treated by conventional liposuction. So it's a nice feeder into your practice. So it's nice having both the surgical and non-surgical arm to really address the variety of patient needs. So this is the next study, a more recent study. This is again by Dr. Tom Fiala. And that was looking at FDA clearance for the flanks. So the primary objective, obviously, was to identify the safety and efficacy for treatment of the flank area. N was 11, so 22 flanks. Obviously, if we have 2, treated for 20 minutes. Patients were followed for 12 weeks and examined routinely at a series of 2 weeks, 12 weeks, and additionally as needed post-treatment. Ultrasound measurements were again used. And what we found, or what they found, was that the treatment had a low incidence of adverse events, which is exactly what we're seeing in practice, with only one subject developing a palpable thickening in the subacute tissue following treatment, noted the 2-week time period, but resolved. And this is important to say, it was resolved at 12 weeks post-treatment. So you're not seeing PAH. PAH is completely different. I've treated a number of patients for PAH. None of these patients had been treated by EON. They had all been treated by competitive devices. And in PAH, as you know, if those of you on the call have treated it, it doesn't go away on its own. These were areas that actually went away on its own. So looking at this, clinical results, this is nice. 0 non-responders, so you don't have to tell a patient, well, 50% of our patients are seeing results. 50% are not. Every single patient actually had a sustained result. The area size was 110 square centimeters per treatment segment. There was 100% subject satisfaction. You don't see that with a lot of devices. Why? Because there are some devices, there are actually a lot of devices where you don't have 100% satisfaction because you have some non-responders. The mean fat reduction was 6.1 millimeters or 15%. And again, a low incidence of adverse events. Small study, I'll give it that, but it was 11 subjects. Age range were pretty wide, 24 to 63, in all fits scale skin types, which is another nice thing as well, too, because, our practices are becoming very diverse, which is a good thing. And depending on where you are in the country, you're seeing patients of different ethnicities, different skin types, and you really don't want to have to turn away someone that may not be applicable or amenable to your treatment. You don't have to turn anyone away with EON because you can treat all the skin types. BMIs, again, a fairly wide range, 22.3 to 34.2, a mean abdominal circumference of 97.9 centimeters with a range right around there. And again, in terms of AEs, one patient had a small degree of palpable thickening, but that resolved after 2 weeks. And it's important to notice that it did resolve. It didn't stay there. So again, and I really apologize. I kind of screwed it up with not showing you the video. I apologize on that one. But this is essentially the positioning that your patients are going to be in. It's very comfortable. These patients, I guarantee you, are probably falling asleep. It's very, very comfortable. Get a room where it's quiet. If you want, play some music. Your patients have on goggles, obviously, to protect your eyes. But literally, all they do is lie down and get the fat melted. Super, 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 super easy. So these are some of the results. You can look at these yourself, obviously. The first one in the upper left, abdomen and flanks, you see a nice resolution there. 5 segments on the right of abdomen and flanks and the results. The bottom 4 segments and the bottom right 3 segments. So you're seeing efficacy, and you're also seeing, too, safety and the fact that these patients actually come back for more treatments. So it's smarter body contouring. And so this is a look at the screen. Super, super easy. It's very, very user-friendly. As it mentions here, EON treatments, single segments are about 20 minutes. You have a small, medium, and large treatment area size. You orient based upon where you're treating, either vertically or horizontally. Full abdomen is usually 3 segments on average, and both flanks, usually 1 segment each flank. So, and bottom here, it talks about the FDA clearance in 19, full abdomen, 2022 for flanks, and most recently this year for the back and for the thighs. So the key thing is you're really treating the big areas that your patients want instead of just limiting it to one area and saying, well, this is the only area we can treat. Now you can really treat the most commonly requested areas. So industry best temperature differential. What does that mean? That means that you're actually melting the fat. So in clinical trials, patients achieve the following results in a single session: 4.1 centimeters in circumferential reduction, a 6.3 millimeter reduction in fat, 21.6 reduction in the abdomen, and 25.3 reduction in the lower abdomen. Okay. And so apoptosis, when we're talking about the temperature differential, the skin stays at 39.5. So think about the fact that there's jet cooling. So the skin is not getting burned. It's not this bulk heating where it's slow and the skin heats up and you have to worry about, about checking the temperature. The device is actually already doing that via sensors. The max it goes up to is low 50, so 51 degrees centigrade. So robotic safety, I think we've kind of talked about this. It utilizes 43 unique sensors that drive its autonomous decision making. We're not supposed to say your technician or whoever is treating can walk out of the room, but let's just say that there's really not a lot for them to do. I mean, it really is not. They set it up, they reassure the patient, and you only have to do that one time, because once the patients have literally been treated once, they know. They come in, they're like, oh, this was cake. They lie down, obviously they're all on their side if they're treating the flanks or they're treating the back, they're going to be prone. But the smart sensors are essentially running the show. They're identifying the heat, the cooling, the proximity from the treatment head to the actual skin of the patient. The only thing that you do want to ask the patient to do is to not move. So you really don't want them talking, because you don't want their abdomen bouncing up and down. You don't want them shifting around. So you don't want your patients to fidget, during the treatment. You do want them. This doesn't show that the person with goggles on, but obviously because it's a laser, you're going to be having them wear goggles. Have them stay off their phone or anything like that. We take their phones from them, but it's super, super, super easy. Pop some headphones in if they really need them. We usually turn on some music, but these patients usually go to sleep and are very comfortable during the treatment. So let's talk about a little bit about the sensors or skin sensors, that are identifying temperature and so forth. So this is what it looks like. It's essentially hovering above the skin, and it's identifying How close is it to the skin? Does it need to go up or down? And it's identifying the topography of the skin as well, too, of the treatment area, because obviously these are three-dimensional treatments. These are not flat areas overall. There are some curves. And so the robot actually adjusts for that. It maps it out in the initial mapping phase, and then it knows exactly where to go, how long to treat, and when it's done. So robot sensors, okay? So there's a force sensor, an overcurrent, a temperature sensor, and a position sensor. I don't understand all that. That's way past my pay grade. All I know is it works. All jokes aside. So laser sensor, there's a power sensor, again, a temperature sensor. It detects driver over the temperature. In other words, if it's overheating, it's going to shut itself down. There's also a laser fiber sensor as well, too. Tons of sensors in this. So it's essentially what it's doing is it's using technology to identify, is it treating effectively and most importantly, safely. And then skin cooling, it uses jet impingement. There's a temperature sensor here, an airflow sensor, and a temperature sensor. It's identifying, and this is the mannequin here, but you can see, thank goodness, he or she has the goggles on, but which you need for all your patients. But key thing here again, and I've said this 10 times already, but the device is actually using the jet impingement, which is a huge step forward. It doesn't touch the skin. It blows air on the skin and literally keeps the skin cool. Now, what happens after you treat, patients will say, and I saw this, or I felt this actually the first time, is the treatment area feels a little bit spongy after the treatment because you've melted the fat, and it may feel a little warm as well too once the jet cooling has been turned off, but it's certainly not hot. It may look a little bit red, maybe like a little bit of flushing, but that's it. You can literally go from here to the gym. There are no restrictions. I tell my patients, instruct them to hydrate well, just because I want to make sure that everything's cleared. They get all the melted fat out. I mean, that's going to be a matter of time. It's not going to be removed in 24 hours, but you want to make sure you have good hydration and so forth. But there's no limit. You can literally do this on your lunch hour with zero downtime, and that's super cool. And that's something that obviously your patients they're really asking for. Additional sensors, there's the device, temperature sensor, and a humidity sensor. Additionally, there's a door sensor, temperature sensor, and air chiller temperature sensor. So I think I've beaten this one to death in terms of the sensors. There's a lot of sensors, and make sure it works well. So this is a jet impingement cooling. So the advantage is it keeps skin cooler and allows for higher laser temperatures in the adipose tissue. Why is that important? Because you need to get up to a certain level to allow for sustained apoptosis. And apoptosis is essentially just destruction of the fat cells. So what is jet impingement cooling? As you can read here, nozzles in the treatment head blast cold air at a high velocity, and it's comfortable. So it's not like you feel like you have liquid nitrogen or something super cool on your skin. It doesn't hurt. As cold air strikes the surface of the skin, the cool air spreads out in a radial pattern. So you can see that on the schematic on the right. The heat from the surface then is extracted by the radial spreading of the cold air, cooling the skin dramatically. So all the heat goes in, the cold actually cools that. So the superficial surface, obviously the surface, stays cool, while internally it heats up and creates a differential, and enough of a heat increase to allow for apoptosis and effective melting of the fat. So what's a temperature differential? Well, that's the difference between the temperature of the adipose layer that's being treated and the temperature of the surface of the skin. So the temperature of the skin stays at 39.5 is which, that's what you want. You don't want it to go much higher in the 40s because that's where burns start occurring. But internally, your temperature is going up to 51 degrees. That's where apoptosis is going. Now, looking at this is the highest differential on the market of currently available products. This is key because your skin is cool, again, protecting it, and internally it's heating up, allowing for apoptosis. I mentioned this highest industry temp differential. This looks at other laser devices, and you can think of the devices that are currently on the market, but this provides the best temperature differential. The advantage, higher temperature of adipose tissue, EON induces apoptosis and more fat cells. The cooler temperature of the surface of the skin, I mean, that's that's kind of a no-brainer. I mean, it's going to decrease the risk for burns. It also allows for more comfortable treatments. And again, I've emphasized that, but that's really, really key, because if your patients are only going to have one treatment, then maybe they'll grin and bear it and say, yeah, it was really painful, but it really worked. I only had to have one treatment. Our patients are coming back for multiple treatments. And so to have them come back on a continuous basis, I shouldn't say on a continuous basis, but coming back for like yearly treatments or touch-ups or what have you, they need to know that they're not going to come in and have an uncomfortable experience. So on the right, this looks at the temperature differential and the heat of EON versus Sculpture, Vanquish, and True Sculpt, which are all much lower and potentially less effective. So robotic reliability, it was engineered to be a platform that can evolve to include other treatments, other treatment areas. Connectivity gives the ability to predict issues and be proactive in the company, addressing customer service, customer concerns. What that means essentially is they can actually access some of the treatment parameters and figure out, are there misfires, what have you. Here's the key thing: there are no disposables, nothing to insert to start treatment, just a device. So you don't have the applicators. You don't need to say, well, do we have any applicators? Oh, we ran out of them Tuesday, we need to order. No, you just plug it in, fire it up, it's ready to go. So smarter choice in body contour for every practitioner. I mean, it really is a no-brainer. The key thing is not only will your patients like it, your team will like it. Okay, your team will like it. Why? Because it's super easy to use. It's a no-brainer. The robot does all the thinking. If you have any questions as well too, and I'll give a shout out to Dominion, is that they're there to help you. Okay, we've not had any issues. We had one time where the device turned off. We called them. They got it fixed quickly. They were on it immediately. Show me a device that's never misfired, that's never had an issue. I mean, it just doesn't happen. We've had very, very, very few, almost no issues with it. And when there's been a question or concern or anything like that, the company stands behind that. So that's really, really key. I mean, there's a saying in the laser industry: what's the best way to get rid of a laser rep? Buy a laser. So that's not the case with Dominion. They have a vested interest because they want you to be happy. They want you, because the key thing is I do calls. Okay, I have people, and if anyone on this call wants to talk to me, I'm happy to do that. I'll give you my experience. I'm in this call tonight. I mean, it's after hours. I could be doing a lot of other things, but you can see I'm actually I'm very excited about it, because I do think I always speak for companies that I use their device, that I think their device is going to be great, because ultimately it's my credentials and it's my reputation on the line. So, it is something that actually works. And again, our patients come back for it. So this is the existing market technology overview. I mean, I think you've heard of some of these names. I mean, obviously this is a heat-based device, all the way to cold, which is cool sculpting. I mean, cool sculpting is the only cryolipolysis with contact, actually the only cryolipolysis device there is. The others use a variety of things. But this is essentially the competitive landscape currently. Are motor devices going to come out? Yeah, they might, but I mean, I think it's going to be really hard to beat this right now, because the device works. Again, I like the touchless aspect of it. It's interesting because when I helped launch it, that was one of the biggest, I think, selling points for me right after COVID, because we were really concerned about touching anything. But now, I mean, if I have something where I don't have to use applicators, applicators do a lot of things. One, they cost money. Two, they take up space. Three, there's something you can miss. In other words, your team may say, well, whoops, we forgot to get, a couple of applicators for this week. We will have to cancel this appointment. You don't have to do that. Again, all you have to do is plug the device in, into the wall, turn it on, get your patient comfortable, and rock and roll. And it's a no-brainer. So robots this is kind of a goofy little picture here. Not sure what I'm supposed to say about it, but robots have been used in surgery for some time. I think, as a plastic surgeon, we're seeing more use of AI and robotics, in a variety of things. And I think this is really only the tip of the iceberg. I think that, autonomous devices, I could go into a whole presentation on this, but, think about it. If you have less to think about, you have a very predictable, safe, effective device that you really don't have to do anything with. that it really eliminates the practitioner. I mean, it really makes for more scale. It allows you as a clinic to perform potentially more treatments per unit time in smaller areas. You don't, your practitioner could be doing something else at the time instead of, actually doing a hand piece on this person, what have you. Super, super, super easy. You also get consistency as well too, and that's in B. Precision drives consistency. Aesthetic treatment results are influenced by two major factors. And I would tend to agree with this: variability in the operator and variability in the human body. These two things are essentially taken out of the picture here because operator variability is taken out because you've got a robot. It's going to be precise, consistent, maps it out before the treatment, and robot knows exactly what to do. There's also variability from each of your patients because every patient is not the same shape, size, what have you. For this, that's what the robot is looking at as well too. I mean, there's mapping right before the treatment, so the robot can figure out how is the topography for this person as compared to the last 20 treatments you did, and so forth. And again, you can look at the bottom. I mean, autonomous intelligence, safety, and reliability. These are all things you're going to hear more and more. They're buzzwords within the robotic industry, but really, these are things that are critically important.
Dr. Buford from Beauty by Buford here with one of our lovely patients who just did the new EON, the first robotic fat melting device in the U.S. Exciting new technology, and we're one of the first in the U.S. to launch it. So tell me a little bit about why you actually underwent this. What were your goals?
For me, it was a matter of feeling confident, rocking crop tops, bathing suits, feeling good, going out, enjoying the Colorado weather in the summer, and being able to wear things that keep me cool.
Very
and
cool.
Look good while I'm doing it.
So the big question is, does it hurt?
Not at all. Didn't
Awesome.
feel any discomfort throughout
Awesome.
the entire treatment.
Cool. Well, thanks for that testimonial. We love working with you. And any of you guys that are interested in seeing this new technology, I've actually had it done myself as well too. My first time a couple weeks ago, no pain, no downtime, no swelling. Really, really nice technology. My second one this afternoon, so stay tuned. Have a great day. We'll see you soon.
So we'll look at some of these. These are some of our early results before and after. I think you can see, a nice result. Does it take away all their fat? No, but these patients are really, really happy. Look at the one on the right. I mean, look at the lower abdominal wall. That's a big difference, big difference. And some of these patients are coming in looking for small results. Is it going to etch or anything like that, like liposuction? No, but your patient also has zero downtime. And these are after a single treatment. Same thing, patient very, very happy. I mean, a lot of our patients start out in great shape, depending on where you are in the country. There's so much geographic variance, but our patients are looking essentially for treatments that will have be associated with very, very little downtime, a lot less discomfort. This has no discomfort, but most importantly, efficacy. Okay. And they want those small little changes. I mean, she's in great shape, obviously, before. She's even better shape after, and she's ready to hit the beach right now with her new look. So another before and after. This is not mine. This is actually a company slide, but you can see a nice difference there. Same thing, male, obviously. Female, I mean, really nice. Look at the lower abdominal. I mean, that's a dramatic difference right there. I mean, that's a nice decrease in circumference. I can't talk here. Same thing before and after here, lower abdominal wall, upper abdominal wall as well too. You're starting to see that definition in the center as well too. We're actually combining this now with some things. We're combining this with, some of the injectable fat loss products, like semaglutide and so forth. It really, really helps. And it's kind of the icing on the cake. Before and after, I mean, pretty nice. I mean, this looks like the kind of the typical dad bod. And then after, guys ready to hit the beach, ready to hit the, do whatever. It looks great. Same thing, female here, lower abdominal improvement. Same thing here. So I was asked to talk a little bit about profitability, and pricing. So suggested pricing, usually do a package of 3 for about $2,500. Single segments, we charge $1,000, so a little bit more. But most people are not getting single segments. We try to, it's kind of like getting a single segment or a single treatment of IPL or BBL, or something that needs multiple. You get an okay result, but it's not going to be amazing. So we try to sell it in packages That's where our patients get the most efficacy. We bundle it. So buy 3 at $2,500. Your fourth, you get a certain discount. That's office discretion. It really depends. Treatment size and all this kind of stuff. There's a number of reasons why we'll discount a little bit, but we don't discount a lot, actually. We discount really only with patients buying bigger packages. In our office, most people are buying at least 3 to 8 segments for optimal results. And it's great because it fits into their schedule. These segments are about 20-minute treatments. They're not hard. Patient can go right to lunch after this. They can go right back and get back in their suit, give a presentation, go on vacation. Super, super, super easy. So it's been highly profitable for us, in terms of how quickly you can pay it off. One thing that I'd recommend, this is a little suggestion. Usually what I do when I'm bringing on a new device is I'll query my current existing patients to say, hey, I'm getting this device. How interested would you be if I told you that I have a robot that can actually melt your fat with zero pain, zero discomfort, zero downtime? They're like, yeah, rock and roll. That's awesome. And then when you have an event where you pre-sell it, you can do enough that you literally can pre-sell and pay off a significant amount. Some practices are super, super busy. They have multiple devices, what have you, or larger practices could potentially pay it off in a very, very short period of time. So that's all gonna depend on you, how aggressive you are with your marketing. You got to get the word out. I mean, if you don't, it's what I call a Picasso in the basement. It's something great, but no one knows about it. So you want to get the word out. And again, I really strongly believe in pre-selling. Get the interest before they even get in. Start that buzz. Coming soon. Get something so that patients, when you do get it, they're ready to rock and roll. Don't buy it and then just go, oh, now we've got to market it. Be ahead of the curve. That's a real key. So current treatment parameters, we're usually doing 2 treatments per area if there's a full or fat. For most of our patients, we're doing high settings, unless the patient's unable to tolerate. I mean, realistically, the first 2 treatments I did the high settings. I just said, you know what, bring it on. And it was super, super easy. I mean, literally, like I said, I fell asleep. And we're usually treating about every 4 weeks or so. Okay. We're now, and I put this in asterisk, we're introducing maintenance treatments, but so far our patients are actually happy with the results after their initial sessions. But here's the thing. Life happens. Okay. Your patients, think about even your liposuction patients. They'll go and they'll say, you know what? Hey, I'm so happy. 6 months later, they're like, yeah, I've been kind of not eating as well. I've kind of fallen off the wagon. I really want to touch up. Instead of bringing them back to surgery, bring them back to EON. I mean, it's something super, super easy as a touch up. So I foresee a lot of our surgical patients actually going to this as a means to maintain their surgical results. AEs, none. I mean, we've seen occasional areas of firmness of the abdomen, very, very infrequent. They've all resolved with Advil and gentle massage. We've had a total of 0 burns or other issues. We've certainly had no paradoxical adipose hyperplasia, which is PAH, associated mostly with your cool devices, okay? But AEs are a huge thing. If you're getting efficacy, but you're also burning patients, it's a roll of the dice, okay? So you really have to factor that in. The nice thing is we're able to look at our patients in the eye and say, you know what? We've had no adverse events so far, and this is super, super easy. It makes the patients come back, and they also are wanting to refer it to their friends and family. So at this point, that's it. So that was kind of the long and short of it. Do we have any questions?
Okay, so we do have a couple questions. I'll just go ahead and pulse them. Someone asked, Dr. Buford, why should I look into EON fat reduction as opposed to other RF modalities?
Yeah, so I think, a couple things. One is it's touchless. You don't have to have a technician. That's one of the biggest things. I mean, it's literally the robotics take the thinking out of it for you. If you can, like I said, if you can have a device that essentially operates itself, that's comfortable, that's effective. No other device does this. I mean, all the other devices you pretty much have to manage while you're there. You have to have someone actually watching them, whether it's a hand piece or what have you. That's why I would do it. And it's super, super easy. I can go through some of these as well too. Adverse side effects with your experience with EON. No, we've had a total of 0 side effects so far. I mean, I'll say if I had to even stretch on that, yeah, we had some firmness on a few patients. but it all went away. So that was, I mean, if you consider that a severe one, no. How many sessions do you typically recommend, since EON gets 3 times as much fat reduction as compared to cool sculpting? Great question. It really depends on your patients. Think about this. I mean, if you say, you know, I can get a lot more fat per segment, do you think your patients will say, well, I only want to get as much as I can get with a competitive device? No, they're going to say, well, if I can get even more, let's do at least as many segments as I would do with a competitive device, but let's get even better efficacy. That's what I would do. I mean, think about it. Their time is valuable and they're paying for it. So they're like, bring it on. I mean, let's get that fat melted. How many treatments do you do in your practice per patient to get results? It really, really depends. We talked about 3 to 8 segments per patient. It really depends on the patient area, you know, what they're starting off with. It's really highly variable. Do you ever do a treatment prior to liposuction? Yeah, actually, we've had patients. We don't do it like if someone's scheduled for liposuction, we're not going to do EON before because they're already going in. But if someone says, you know what, I want to trial this and just kind of see, yeah, we've definitely done that. And there are areas where too, you know, just for full disclosure, that you can't use EON. So, you know, those may be some areas where you can do liposuction in some areas with EON, and then in the office or the OR with liposuction. Treatments are you combining with EON? So treatments we're combining with EON, we are combining semaglutide. We compound that in the office, or compound that, whatever, sell the office and follow patients so they get rid of intra-abdominal fat, because EON's not going to take care of intra-abdominal fat. We're also combining a number of other things like skin tightening over time. There's a lot of, it's a really good segue, because once your patients lose that weight, if you want to skin tighten, we've used things like Vivace RF to tighten some of these areas. I mean, I think really combination therapy is really where most people are going. Do you have other fat machines in your office? No. And, you know, I don't want to bash cool sculpting. I mean, cool sculpting is kind of the big 800-pound gorilla in the room. Everyone compares themselves to that. But the challenge with me is there was a lot of cool sculpting devices in the area. I didn't want to be just another person. And quite honestly, this is completely different. Cool sculpting, you have applicators. It's a whole different thing. Again, I'm not going to bash it, but if I have something that is as effective or more effective, that doesn't touch me, that's super comfortable, and I don't have to buy any applicators, no disposables, the answer is simple. Can you do a trial treatment on an area? Yeah, you can actually. In fact, actually, the company allows you to kind of test drive this on a patient without charging, which I think is great, because your patients say, I want to see that it doesn't hurt. Now, we have videos in our office showing me getting treated, showing other testimonials and so forth. I mean, we don't have to do a lot of those, but it really is an easy thing that allows your patients to essentially, again, test drive it for a couple of minutes, and they're like, oh, that's easy. Let's do the full treatment. No problem at all. How have you incorporated EON into your surgical practice? And have you seen better results combining with surgery? You know, in some of these areas, yes. I mean, ultimately, it really depends on the patient. Everybody's a little bit different. But I think for me, it's been more of a feeder into my surgical practice, because, you know, some people will come in and they'll say, you know, I want to be treated on all these areas with EON, but can you do anything with this double chin? EON right now is not FDA approved for that. And I don't know if that's along their area, their scope, but we can't treat in that area. So I'll do another treatment, a surgical treatment in that area, and I'll use EON for the other areas. So I think that's actually all the questions. I appreciate you teeing up the videos, because I do think the videos are powerful and they really show how the device works. I guess I would close by just saying, you know, I'm a surgeon. I'm not supposed to get excited about energy-based devices, but I've been in practice for about 21 years, and things have really changed. I mean, the whole notion that surgery is the only option for patients is really antiquated, and it's not true anymore. There are patients that, for a variety of reasons, are not surgical candidates. For, you know, they may not be medically ready for it. They may not be psychologically ready for it. They may not be financially ready for it, what have you. This offers a great way to essentially show your patients what they can do. And it actually is great for all body contours. again, we have a lot of patients that are in great shape, but they just have problem areas. They have that dense fibrous fat that, especially the flanks, what have you, they're like, you know what, no matter how much I work out, I can't get rid of it. It's a really, really nice way to bring patients in the practice. And ultimately, you get the patient in the practice. Think about this. You have an injectable practice, you have a surgical practice, you get them in the practice, and you can keep them in the practice. So I think for that reason, body contouring, energy-based devices, they're really a necessity now. I didn't think it was a big deal until I got it. And now I'm like, you know what? Yeah, it was a really smart financial business decision. So if anyone wants to contact me, reach out to the company. I'm happy to talk to you. Like I said, I've been using this for several years. So certainly we've done a number of patients, we've treated a number of patients, and I'm also a patient as well too. So I can give you my experience as well too. But it was easy and it was boring.
Wonderful. Well, thank you so much, Dr. Buford. That will conclude our webinar. Thanks again for everyone joining us, and have a great evening.
Perfect. Thank you, guys.